Have you ever thought about how much your liver does for you without you even noticing? It filters your blood, removes toxins, stores energy, and supports your immune system. But when your liver is in danger, it often whispers before it screams. And by the time symptoms become obvious, the damage might already be serious. So in this video, we're going to talk about 10 shocking signs your liver might be in trouble and how to catch them early before it's too late. Let's begin. 1. Persistent fatigue. Feeling tired all the time, even after getting a full night's sleep? When your liver isn't functioning well, it fails to properly break down toxins. These toxins stay in your bloodstream, affecting your energy levels. In fact, fatigue is one of the earliest and most common symptoms of liver dysfunction. If you're dragging through your day despite rest and good nutrition, your liver might be the reason. 2. Yellow skin or eyes. Jaundice. Have you ever seen someone with a yellowish tint to their skin or the whites of their eyes? That's called jaundice, and it's often caused by a buildup of bilirubin, a yellow pigment that your liver normally clears out. When your liver can't keep up, this pigment leaks into your body. Jaundice is a clear sign that your liver needs urgent attention. 3. Unexplained itchy skin. A little itch now and then? That's normal. But if you constantly feel the urge to scratch, especially at night, your liver might be to blame. When bile salts build up under your skin due to liver dysfunction, it can cause intense itchiness. This isn't just dry skin, it's a warning light. 4. Swelling in the legs, ankles, or abdomen. Do your shoes feel tighter than usual, or your pants press against a bloated belly? Swelling in the lower limbs or abdomen, as known as ascites, is often a result of liver disease. A liver regulates fluid balance in your body. When it fails, fluid leaks into tissues, causing puffiness. It may look like simple weight gain, but it could be a sign of something far more serious. 5. Easy bruising or bleeding. Notice more bruises after mild bumps or bleeding gums. Your liver produces proteins that help your blood clot. If your liver is damaged, these proteins decrease, meaning you bruise and bleed more easily than usual. This might seem harmless, but it's actually your body waving a big red flag. 6. Loss of appetite and sudden weight loss. We all skip meals now and then, but if food no longer appeals to you, especially over several days or weeks, it's worth paying attention to. A struggling liver affects digestion, reducing bile production, which is essential for breaking down fats. Over time, this leads to nutrient deficiencies, muscle loss, and unexplained weight loss. 7. Dark-colored urine. Is your pee darker than usual, even though you're well hydrated? That might be bilirubin again. If your liver isn't processing this pigment properly, it escapes into your bloodstream and eventually your urine. While some foods and supplements can affect urine color, consistently dark urine is a red flag worth checking. 8. Pale, bloody, or clay-colored stool. We get it, talking about poop isn't glamorous, but your stool reveals a lot about your health. If it's consistently pale, clay-colored, or even has blood in it, this could be a sign that bile flow is blocked or your liver is inflamed. Healthy bile gives your stool a brown color. Anything else could be a sign of liver trouble. 9. Confusion or difficulty concentrating. Hepatic encephalopathy. Can't remember things like you used to, or feeling confused without any clear reason. When your liver doesn't filter toxins like ammonia from the blood, those toxins reach your brain. The result? Brain fog, memory loss, and even mood changes. This condition is known as hepatic encephalopathy, and it's often overlooked. 10. Red palms or spider-like veins. Look at your palms. Are they unusually red? Do you have small, spider-shaped blood vessels near the skin surface? These signs are known as palmar erythema and spider angiomas. They often appear with cirrhosis or hormonal imbalances caused by liver damage. While they may seem cosmetic, they can signal deep internal dysfunction. So, what should you do? If you've noticed one or more of these signs, especially in combination, don't panic, but don't ignore them either. Here's what you can do. Get a liver function test. Blood test. Avoid alcohol and processed foods. Eat liver-friendly foods like leafy greens, turmeric, garlic, and berries. Stay hydrated. Maintain a healthy weight. Talk to a doctor for early screening if you're at risk, as in due to obesity, alcohol use, or hepatitis. Remember, your liver is one of the few organs that can regenerate, but only if you give it the chance early enough. Now it's your turn. A. Have you ever experienced any of these liver-related symptoms? B. Did something in this video surprise you or open your eyes? Let us know in the comments. We'd love to hear your thoughts or experiences. And don't forget, our target is to get 1,000 likes for this video. Also, make sure to hit that subscribe button for more life-saving health tips every week. Your health is your wealth, and the liver is your silent hero. Let's take care of it. See you in the next video.